Imagine a sudden illness or accident strikes, and you need to rush to the emergency room. It is a stressful situation, and the last thing you want to worry about is an unexpected bill. Knowing how your health insurance works in these moments can bring a lot of peace of mind, especially when it comes to understanding what you might owe. An emergency room copay, often shortened to copay, is a specific fixed amount of money you are required to pay out of your own pocket for an emergency room visit. This payment is due at the time of service, or shortly after, and it is a fundamental part of how your health insurance plan shares the cost of your medical care with you. The reason copays exist is primarily for two key purposes: cost sharing and appropriate care utilization. Firstly, they help distribute the financial burden of healthcare services between you and your insurance provider. Secondly, copays are designed to encourage people to use the most appropriate level of care for their condition. For instance, a small fee for an urgent care visit might be lower than an copay to incentivize you to choose urgent care for non-life-threatening issues, reserving the for genuine emergencies. The specific amount of your copay can vary significantly based on your health insurance plan type, whether the is in-network or out-of-network, and if your visit ultimately leads to a hospital admission. To find out your specific emergency room copay, the best place to start is by reviewing your health insurance plan's summary of benefits and coverage document. This document outlines all your cost-sharing responsibilities, including deductibles, co-insurance, and copays for various services. If you cannot find the information or have questions, you can always call the member services number on the back of your insurance card. They can clarify your exact financial responsibility for an emergency room visit. It is important to remember that insurance companies define a medical emergency as a sudden and unexpected medical condition that places your health in serious jeopardy, and that requires immediate medical attention. Your insurance plan will cover appropriate visits even if you are unsure if the facility is in your network, as long as it is a true emergency. However, for non-emergency situations, choosing an urgent care center or your primary care physician can often result in significantly lower out-of-pocket costs compared to an copay, which can sometimes be several $100s. Ultimately, understanding your emergency room copay before an emergency happens is a powerful way to feel more prepared and in control of your healthcare decisions. It allows you to anticipate potential costs and make informed choices about where to seek care, ensuring that you can focus on your health and recovery without added financial stress.